Well, welcome viewers, Dr. JWAU theologist. I'm really sticking my nose out this time. Islamophobia explained. When phobia still meant fear. Have you ever heard a word used so confidently that nobody stopped to ask whether it still meant what it appeared to mean? The investigation begins inside a clinical room. A patient cannot board an aircraft. Another cannot enter a lift. Someone else cannot approach a dog without panic overtaking the body. Their breathing changes, their heart races. Avoidance begins controlling work, travel, relationships, and ordinary life. This is where phobia has a defined clinical meaning. A recognized phobia is not merely dislike, disagreement, suspicion, disgust, offense, or criticism. It is an anxiety disorder involving persistent and disproportionate fear, avoidance, distress, duration, and measurable impairment. Specific phobia, social anxiety disorder, and agoraphobia, each have diagnostic boundaries. A diagnosis is not creating by attaching the suffix phobia to a person, religion, object, institution, or idea. Now you got to listen to this, viewers. Viewers, you've got to get into this. This is a lot of work's gone into this to make it easy for you to grasp. The investigators encounter the word Islamophobia. It comes from the Muslim Brotherhood. They made this word up to sabotage the Western world from investigating Islamic ideology in its deepest core. It sounds psychiatric, yet it is not recognized as a diagnosis. Islamophobia is not recognized as a diagnosis. A clinician would not diagnose Islamophobia because he would not be able to. It's not in the DSM. And if a person experienced severe fear related to Muslims, mosques, or Islamic environments, the clinician would assess an established condition such as specific phobia, trauma-related disorder, or another anxiety disorder. This first finding is therefore unavoidable. Islamophobia does not belong within the recognized clinical phobia system. I'm going to say that again. The first finding in this study, and I'll put my credentials on the line, the first finding is therefore unavoidable. Islamophobia does not belong within the recognized clinical phobia system. Yet the word carries the emotional force of a medical condition. It can imply irrationality, instability, or pathology before any evidence has even been examined. The word has left the clinic, but it has taken the authority of the clinic with it. These people running around diagnosing Islamophobia are not clinicians. The next episode follows that authority into politics, institutions, investigations, and public argument. Viewers, come in for the second episode. It's going to be massive.